Good morning. Welcome to the Medicare Cafe. We have just a couple more minutes before the real shindig starts. But we just wanted to log on for a couple minutes early just to go over some pre-chat stuff. As a reminder for Medicare Cafe, because we are after October 1st, we do kind of start the What's Brewing series, which is basically just like industry updates, what's going on, what are agents saying, what are consumers saying, and just kind of keeping you abreast of what's going on out there in the industry. Today, we will be talking a little bit about that government shutdown, as well as what are agents saying the first full week of AEP. But before we do, Chalen came into my office this morning, and I was very focused on what I was doing. What was I doing? Which never happens. My focus.
No, I've totally ignored me the whole time.
My focus just like never is on one thing. And so today it was. And so here's what I was doing. I was working on my continuing education credits this morning.
Yeah.
Because I was like, oh, those are going to be due in November. And like, I have a lot going on between now and November. I probably need to go ahead and get those done. I was working on ethics and compliance. Everything was great. I did pass with 100%, which I'm also surprised at. Do you know why I'm mad? Because I spent so much time. If the Department of Insurance person in charge in Missouri is watching this, no, you're not. Mind your business. I spent so much time copy and pasting because you go through like the learning materials and then you take the test. I spent so much time copy and pasting the data from that one onto a Word document so I could search it, like Control F search keywords just to take the test. Because all my testing before that was like Medicare stuff and like Medicare. And like I was like, I don't need that. I'd been doing this it was my 13th AEP. I don't need that. This one I was like, there's probably some very technical questions they're gonna ask. Chalen, I spent like 2 days of just like time in between meetings, getting that stuff done. Do you know what these questions were? Like, should you break hips in exchange for signatures? Should you lie to somebody if it means the sale will go faster? Should you sell the products only based on their commissions and nothing else, and who has the most commissions? Like, these are the questions that asked me, and I'm like, this is a joke.
Yep.
I'm so upset. Like, it's great because now they're easy and you can get back to selling and the important things so much faster. But the amount of crap that I had to go through on the actual ethics stuff and like asking very specific questions. Like, to be fair, I did learn just a couple extra like TPMO guidelines. I did learn a couple extra things from doing it, but that's not what I was quizzed on.
Yeah.
I was never that kid in high school or elementary school that was like, we were assigned homework, you haven't collected it yet. Or like, we were supposed to have a test today. Like, I was never that kid. I'm not that narky kid. I'm not that person. I'm the person that's like, let's just see how we do this and move on with our lives, right?
For sure.
I'm upset that test was so easy. The amount of time I spent preparing for it.
You stand alone on this hill.
I know I do. Whoa! I touched that button! We're back.
Go.
He just needs to go away.
Sorry, the DOI got to her, guys.
I'm heated about this. I am. I'm mad about, and I also typed some things. I'm mad about. And again, like, I'm not that kid that was like, hey, I said, the homework was due. Why aren't you collecting homework? And everybody's like, oh, why'd you talk about it? That's not me. I'm the kid that's like, shut the frick up, narc. I'm upset that the test was this easy. Anything to add, Mr. Compliance Officer?
Listen, I was not that kid either in middle school. I went through like a big phase in middle school where I didn't see the point in homework, and that was a big problem for my teachers.
Sure. I disagree. But like, one of these days, we'll have a Medicare Cafe after hours where I will be drinking an espresso martini because those are officially my favorite drinks right now, and appropriately so. And one of these days, we're going to talk about why I think homework is absolutely unfair.
Oh, yeah.
And it's actually like an economical social problem versus like a kid being lazy problem. But we won't get into that today because today, welcome to the Medicare Cafe. You are joined by your host. My name's Olivia Richardson.
And I'm Chalen Jackson.
And today, again, like I mentioned, this is a espresso. What's it called?
Brewing?
What's Brewing? Espresso would have been good, though. Short, a good kick. What's Brewing? It's an espresso. And today, what I want to kick off, first of all, I want to kick it off. Chalen made a really impressive video in last week talking about the government shutdown and what you need to know as an agent going into this enrollment season, which is like also, I'll be curious to hear from you, Chalen. The CMS pause is also coming up. That always
Mhm.
happens in the middle of AEP. So how will the shutdown affect that
I've
pause?
never understood why.
Yeah, it's
Like, why do they schedule
why
that
do
in the
they
middle of
schedule this
AEP?
CMS pause where they just don't work for
Mhm.
2 weeks during AEP? But I would love to. But anyways, we'll get into the government shutdown. If you want a
Yep.
full down low on what that is, check out Senior Marketing Specialist YouTube page. Chalen has a really cool video where he's doing this, and it was giving alien vibes. Aliens. So check that out. But if you just kind of want the condensed version of what we can expect, Chalen, hit us with some shutdown facts. What are we doing?
Not much.
Literally
Right
nothing.
now, not much.
Nothing.
No. So yeah. So the shutdown could cause some problems if it lasts long enough. We hit 1 week today, so we're 1 week into the shutdown with no sign of it stopping anytime soon. But for our purposes as agents in the Medicare space, there's not a ton of short-term impact.
Okay.
The Medicare is still going to process claims. They're still going to process apps. They're still going to process new A and B, like Social Security will continue to process A and B enrollments. The biggest, so in terms of like the function and structure of annual enrollment period and the craziness of the 54 days we're about to experience, nothing about that will really be impacted in a significant way.
That's good to know.
What is impacted is on September 30th, because they chose not to extend it by passing another funding bill, 2 major provisions of Medicare coverage did expire. One being the hospital at home program, and 2 being the Medicare expanded telemedicine access.
Okay.
So those did expire on September 30th.
And those originally were due to COVID, right? Okay.
They were. So they had been continued and were likely to be continued again. But since they couldn't reach a deal, those were automatically expiring at the end of September. So now folks, by and large, don't have access to telemedicine for more specific services on Medicare. In rural areas, they may still have access to certain telemedicine, but they have to like basically go to their local rural hospital to have telemedicine with a specialist that's not at that hospital, which is weird.
That's not helpful.
And then anyone who was receiving those hospital at home services had to either be discharged or moved to a facility last week. So that's been a pretty big impact to the folks that are utilizing those services. The other big thing that will be affected by the shutdown is, so we're in October now. We typically get the September, inflation index and wage indexes. All of that stuff gets calculated on a monthly basis. October to September is the timeline we use to set Medicare Part B, A and B premiums, deductibles, copays, all of that. So since the government agencies that calculate the actual consumer price indexes aren't able to do that for September yet because that's not essential work, that is going to then downstream delay the new Part B premiums. So doesn't necessarily mean they're going to change. We've got, broad speculation from a lot of places saying, $206.50 will be the new Part B premium.
Which kind of lines up with the COLA increase.
Yeah, I mean, and those estimates from those agencies are usually pretty spot on.
Yeah.
I mean, they've done this a while, but until the agencies are able to set up the consumer price index increases for September, and then Social Security and Medicare can take that and set the premiums. So it could be Thanksgiving or even, after the 1st of December before we actually know what the 2026 A and B premiums and deductibles will be.
Got it. Again, which, how does that affect buying or shopping behavior? Maybe it doesn't.
Not a
except
ton.
for, looking, maybe some people would have looked harder at those Part B givebacks, or people on a med sup may have moved to a Medicare Advantage. But as we know, even with that, the rates of people moving from an Advantage to a Med Sup is not a high rate.
No.
So I don't imagine that would have been that impactful. But still just conversations we're probably used to having during appointments that'll now be happening after appointments.
Correct.
So, interesting.
Yeah, I mean, any other major impacts are going to depend on how long the shutdown lasts. If somehow it lasts through the end of the year, then, we'll start to see major impacts to Medicaid, to CHIP, to some of these other programs. But short term, for the purposes of getting into AEP, we're still all going to start taking apps on the 15th.
Yeah. The only thing that I've talked to as far as enrollment technology, what we're seeing is that one, CMS updates, like if plan changes or inaccuracies are showing on Medicare.gov, which they often do, especially the first few weeks, those aren't getting corrected as if it's longer than 2 weeks.
They should still get
They
corrected.
should, okay.
Yeah. So CMS actually has a large percentage of their staff that are considered essential.
Okay.
So they actually kept around 51% of their staff on board
That's
through the
good.
shutdown.
Okay.
So it's like 3,400 people.
Okay.
So a little over half of their total staff. So they're still there. They're still doing their work.
Yeah.
And it's all stuff that is primarily related to actually running the Medicare program.
So
things that are on pause are rulemaking, some appeals, some oversight of Medicare administrative contractors.
okay.
But the actual running of the Medicare program is full steam ahead.
So what there are concerns with when I'm talking about what this affects on the technology front, Integrity Connect, Integrity Connect Plus, what is this affecting? The biggest thing is right now, plans that Integrity Connect or Connecture, plans that they don't have contracts with, plans that are non-enrollable, those cannot get put on the site until 10/15. So anything that is enrollable through Integrity Connect, you're already seeing it. It was there 10/1. What you're not seeing are plans that, again, those regional players that do not have enrollment capabilities on Integrity Connect. They said that it is possible at this point, the shutdown's been going long enough, that come 10/15, those, because they have to rely on CMS data for that come 10/15, we may still not see those regional carriers on the platform because of now the delay due to the shutdown.
That's possible, but I have to imagine that CMS is going to do everything in their power to get that data out in a timely fashion because, someone would have to want to. But if you're sitting here and you're a regional plan that doesn't work with agents and you only do direct enrollments and 10/15 CMS doesn't have your data on the Medicare plan finder, like that's a pretty huge lawsuit waiting to happen in my mind.
Sure.
Because all of a sudden your primary source of enrollment, if you don't work with agents, is going to be something like Medicare.gov. So it seems to me that they would be working pretty hard to get that updated, but time will tell.
Yeah, right. Okay.
Time will tell.
So there's what you need to know. Again, like I mentioned, Chalen did put out a video last week going into more of the details regarding the government shutdown and the effects of that. So give that a listen. For the last few minutes, again, this is a What's Brewing episode, which means we try to keep it to about 15 minutes or less. For and let me just make sure I'm not having any texts come in. I don't think so. Yes, so Sadie, she asked, so just to be clear, we should not break hips. Correct, Sadie. So you might want to change your sales practices to not include hip breaking. Thank you for clarifying. These are the top questions that our agent support team and our agent sales team, these are the top questions that we're getting from agents, kind of signifying what's going out there in the industry. Just before we get that, some Integrity Connect updates for you guys who are getting those. As we know, 10/1, we were really excited this year to see 10/1, all plans minus the ones that are suppressed and minus the ones that are not agent ability or not third-party sales, don't allow third-party sales. They were on the website. So excited about that. Very excited. Here are some things that we are seeing. Just again, some glitches and some bugs that are in the process of being fixed, just so you know. Number one, the slowdown. 10/1, as we noticed, we expect about 11,000 agents on the platform at any given moment throughout the day. On 10/1, that number was well over 30,000 agents at once. So they have a lot of that slowdown fixed. They've increased the servers. They've turned on boosters. I don't know what that's not the correct way, but that's what I'm going to say.
Sure.
So we shouldn't be seeing the slowdown that we saw initially in 10/1 and a few days following. We should be seeing pretty normal speeds as far as utilizing Integrity Connect. Reminder, we are seeing that some people are saying, oh, I did my certifications for Devoted. I did my certifications for UHC, but I'm not seeing them on the platform. Just a reminder, Integrity Connect does use ready to sell reporting for updating their permissions on the platform. So if your data is not on the ready to sell report, number one, double check that you are truly ready to sell, that your licensing are up to date. That was one agent. Said like, oh, I didn't realize my license had expired, which is why I did my CE credits. Don't spend that much time studying for it. Just a warning. But anyways, so just a reminder of the self-adaptation, that if it was a carrier that you had on Integrity Connect last year or up to this point, you can just self-attest that you have done those certifications and your permissions will get turned on. We're getting a lot of questions about Medicare Link and United Healthcare. That is the Sunfire platform within Integrity Connect. Number one, don't use it. It's not nearly as good because we're seeing a ton of these glitches. So they are aware that some carriers, including United Healthcare, are not showing the correct permissions within Sunfire. That is a Sunfire issue.
Yep.
The Integrity team are trying to fix it, but what a good reason, just like check out Integrity Connect. And then the last one is, it's actually small, but it's not small when you're talking to a client. But Humana Premium and Humana just dollar amounts when it comes to their PDPs are having weird rounding issues to where like you're getting like if it's like actually like 2 cents, it'll like if it's like $1.02, I don't know why that would ever be the thing, but like for an out of pocket, it'll just say $1. And so just like they're having a weird rounding issue that they're getting worked out as well. So those are kind of like your updates of like these are kind of the mass issues that we're seeing across Integrity Connect. But really excited for kind of how smooth that went. Especially for 10-1. It wasn't that long ago that on any platform, Sunfire, Connecture, the artist previously known as Medicare Center, that 10-1 was just like chaos.
Mm-hmm.
And nothing was right. Everything was chaotic, and everybody was frantically trying to get it because
it gets easier every year.
And every year it gets better and easier, and easier is a strong
but
term.
It's still 10-1. It's still 10-1.
It's still 10-1.
I think people really underestimate how much it's kind of like building a totally new system every single year.
Yes.
Like I really do. I think a lot of
scratch
folks, they're like, well, you've had Integrity Connect all year. Like it's always been there. Why isn't it just changing the year from 25 to 26? It's not.
It's like
it's not
literally
that.
That's such a great way of putting it. It's rebuilding the platform with this new data.
Mm-hmm.
And taking your client data from the old platform and putting it into this new platform every year. So, yes.
Yeah.
It was a great year, though. It was a great kickoff, great launch. Excited to see that continue. The last few things are just kind of like questions that we're getting things we're getting a lot of questions on as far as like agents calling into us, emailing us, communicating with us. First of all, is crosswalking versus SAR.
Mm-hmm.
So a lot of carriers are coming out, you reach up to your upline, but a lot of carriers are coming out with like, these are the plans that are truly being crosswalked. Crosswalking means that it's not necessarily an SAR because these people who are on this plan is no longer existing, but they are being automatically put onto this new plan. So if they do nothing this AEP, they will wake up January 1st with coverage with the same company. The plan just might look a little bit different. It'll be a newly named plan.
So I think that's a good thing to talk about because I want to talk about the 3 or 4 different types of like automatic plan changes.
Let's talk about her.
Crosswalks is one where you go from one plan to another within the same carrier where maybe they're combining plans or maybe they're rolling an old H number into a new H number. That's one form. An SAR is where that old H number simply doesn't exist and it's not being rolled into a new plan.
And that opens up your guarantee issue windows.
That does open up your guaranteed issue. Crosswalks do not.
Yeah, crosswalks do not. Great point. Crosswalks do not. SARs do, both an enrollment period between December 8th and February 28th, where they can get into a new, is it February 28th?
Yeah. It's just the end of February.
The end of February where they can, basically use another election during that time and GI to a med sup. Sorry,
correct.
Go ahead,
No, you're good. So the other one that I see a lot of confusion with is when a plan changes its name.
Yeah.
So it's not a
which
crosswalk.
is happening this year in
is.
several. Yes, that's a great
it's
point.
not a crosswalk. It's not an SAR. It is the exact same contract ID, the exact same plan. There's just a different name on the card. That's all it is.
Yeah.
So the only other one that I think gets folks a little bit confused is for folks that have low-income subsidy. If they have only a standalone drug plan or if they have no coverage, they will get auto-enrolled into a drug plan that meets the below benchmark standards in their state, and that'll be done through the state Medicaid agency. Typically around the second, third week in November is when those enrollments get actually processed through CMS.
Yeah.
So they can override that by making their own choice. But if their plan has a premium above the benchmark, they may be responsible for a portion of that premium. But we get tons of questions about all of those like weird enrollment changes.
Speaking of people paying a premium that weren't used to paying a premium before, that's a big question that we're getting right now is around WellCare. WellCare, a lot of individuals, not in every state, but in a lot of states, a lot of individuals who had a WellCare plan that was $0 premium are now experiencing a premium, still small, but still be experiencing a premium. So making sure that those clients are getting and responding to information from WellCare requesting EFT information and making sure, because again, a lot of people did not include that because the plan had no premium. So just making sure if you are in a state where the WellCare plan PDP now does have a premium and you have a book of business on that, making sure that you're communicating with your clients that they need to pay attention to those communications and now include EFT information or however they're going to pay for it.
EFT, Social Security, something like that. I remember there was a statistic some time ago. It's only like 30% of Part D plans where the premiums are paid by Social Security deduction. So it's the vast majority is EFT or paper bills.
Yeah.
But definitely gonna be a lot of follow up after the first of the year.
Yeah, because you don't want somebody, because it's such a small amount, but still, if they go how long without payment, then they get
2
kicked
months.
off. So yeah, so definitely really important. It is a small amount. It seems insignificant, but it's very important, especially that your people are paying for their coverage that they're not used to paying for. And then last but not least, we have a lot of people asking for go-to-market strategies now that we're getting to see and new information is coming out about plans that are compensated versus plans that are at a discount compensation versus plans that have zero compensation, how to keep them straight. Number one, again, Integrity Connect does let you know if a plan is commissionable or non-commissionable. And then just paying special attention to the ones that are doing like that aren't full market value is going to be United Healthcare. So just making sure you understand which plans in your areas that you're working with are going to be paying a full commission versus the less than full market value. That's a lever that we've not seen carriers. I've never experienced that, where carriers, it's usually kind of all or nothing.
Yep.
More so on the all, less so on the nothing. This is the first year that we're really seeing a carrier experiment with like levels of commission within their
Yeah,
limits.
I mean, we saw it with PDP several years ago. Like I remember,
like the Cigna.
I remember like what was it, 4 years ago that they started paying reduced comp on the like legacy Silver Script block, like the old pre-acquisition days of Silver Script. But yeah, it's new territory.
Ooh. Pre-acquisition of SilverScript would have been even predated 4 years ago. That would have been,
But they didn't change the comp until like 4 years ago.
Yeah. So it's very interesting, but just keeping that in mind, utilizing those tools, anything that we can do that automates this versus you having to do research is key. So using the tech like Integrity Connect to help you with and understand that. Very, very great point. Guys, it's 10:20. Appreciate you guys who are joining us. I was reading through some text messages, mostly just like people agreeing with us and commenting on some things. I am getting called out by somebody in our office, Matt Beach, for having an Medicare Center mug. This is my favorite mug. No, it's no longer called Medicare Center. It is Integrity Connect.
Integrity Connect mugs.
We don't have Integrity Connect mugs. This is my favorite. I've had this for years, and I refuse to give it up. So, sorry, Matt Beach. Bleh. That's the most intelligent response I can have. Nuh-uh. Your Medicare Center. Your mom's Medicare Center. Okay. Appreciate you guys. If you have any questions, comments, concerns, threats, or promises, let us know. Or shoot me a text. That is my real number, so you can text me at any time, and I'm happy to respond. But happy AEP.
Happy AEP.
Here we go. May the odds be ever in your favor. Until next time, guys, have fun.
Make money.
And give impeccable service. Thanks, guys. You've gotten so good at that. I'm very proud of you.